Assalamu alaikum, طلبتنا الأعزاء. Today our lecture is about chronic inflammation, presented to you by Dr. Rasha Al-Safi. The objectives of this lecture: number one, definition and causes of chronic inflammation, identify the cell of chronic inflammation and understand the etiology and main features of granulomatous inflammation. Chronic inflammation is a response of prolonged duration, weeks or months, in which inflammation, tissue injury, and attempt at repair coexist. يعني كلها موجودة together in a varying combination. It may follow acute inflammation or it may begin insidiously. يعني ممكن أن يتبع acute inflammation أو يبدأ فجأة as smoldering, sometimes progressive process without any sign of preceding acute inflammation, and it may complicate the acute inflammation. ممكن أنه preceded by acute inflammation and يتبع يعني complicate the acute inflammation. The acute inflammation اللي نسميه the later يعني is almost always a suppurative type of acute inflammation, which is complicated by chronic, that present as a purulent discharge or pus as seen in abscesses. So the type of acute inflammation which is followed by chronic is almost always a suppurative type. Chronic inflammation is the cause of tissue damage in some of the most common and disabling human disease like rheumatoid arthritis, atherosclerosis, tuberculosis, and chronic lung disease. What are the causes of chronic inflammation? Number one, persistent infection by microorganism, which is difficult to eradicate, such as mycobacteria and certain viruses, fungi, parasites. These organisms evoke an immune reaction اللي نسميه delayed hypersensitivity reaction. This inflammatory response take a specific pattern نسميه sometimes granulomatous inflammation. And in other cases, unresolved acute inflammation evolve into chronic inflammation, such as when acute bacterial infection of the lung progress to chronic lung abscesses. إذن احنا عندنا persistent infection اللي هي ممكن أن تؤدينا إلى inflammatory response اللي هي take a specific pattern and start from the beginning as a specific type of chronic inflammation اللي هو granulomatous inflammation. أو إنه other cases acute inflammation followed by chronic اللي هي acute bacterial infection in the lung for example اللي تتحول إلى chronic lung abscesses. مثل ما قلنا it is a suppurative type of acute inflammation اللي يعطينا بعدين chronic. Number two, ممكن prolonged exposure to toxic agent. Number three, hypersensitivity disease. Chronic inflammation play an important role in a group of diseases that are caused by excessive and inappropriate activation of immune system. يعني immune system of our body work inappropriately to attack our own tissue. يعني هذا يعتبر inappropriate response of the immune system. In autoimmune disease احنا بنقول auto self معناته the self antigen evoke a self-perpetuating immune reaction that result in a chronic inflammation and tissue damage like in rheumatoid arthritis and multiple sclerosis. In allergic disease, chronic inflammation is the result of excessive immune response against common environmental substances. يعني مثلا somebody is not sensitive to certain type of allergen which is cause allergy to another person. يعني احنا مو كليتنا نتحسس لنفس الانتيجين. لذلك بالالرجيك disease in some patient or in some person هي عبارة عن excessive immune response against common environmental substance اللي هي بالعادة ما تسبب allergy. As in bronchial asthma, مو كل الناس عندهم bronchial asthma. بعض الناس عندهم bronchial asthma. Why? Because they are sensitive to common environmental antigen, which is not cause hypersensitivity reaction to other person. Such disease may show morphological pattern of mixed acute and chronic. يعني هو ممكن أنه يبدي as acute وينتهي بالchronic response because they are characterized by repeated bouts of inflammation. Fibrosis may dominate the later stage. طبعا due to chronicity راح يصير عندنا fibrosis. later on, as we'll discuss later. What are the morphological features of chronic inflammation? Number one, infiltration with mononuclear cell عكس acute inflammation. كان الدومينانت cell in acute inflammation هي النيوتروفيل. هنا mononuclear cell اللي هي الماكروفاج, الليمفوسايت and the plasma cell. Tissue destruction is more severe, induced by persistent offending agent or by the inflammatory cell itself. Number three, attempts at healing. يعني الجسم يحاول يسوي healing by fibrosis, by connective tissue replacement of the damaged tissue accomplished by angiogenesis. أول مرة يرجع التشيو إذا كان capable to replicate. Later on, angiogenesis اللي هو proliferation of newly synthesized blood vessels, and in particularly the healing process, particularly by fibrosis. طبعا because of the chronicity of the process. This is a histological sections showing a comparison between the two processes of acute and chronic inflammation in the lung. طبعا ال A اللي هي chronic inflammation in the lung, showing three characteristic histological feature. احنا عندنا there is a collection of chronic inflammatory cell, هاي المؤشرة بالنجمة or a star, collection of plasma cell for forming a focus inside the tissue, and destruction of the lung parenchyma, or اللي هي بنقول parenchyma يعني the tissue of that organ. The destruction of the parenchyma اللي هي normal alveoli اللي هي arrowhead, تشوفون فقط الهيد راس السهم مؤشرة. These are the alveoli destructed, and the lining of the alveoli replaced by spaces lined by the cuboidal epithelium, which are not the normal lining طبعا. وثلاثة replacement by connective tissue fibrosis. هذه الأرو الأسهم الكاملة تشوفون there is a fibrous tissue in between the destructed alveoli and multiple foci of inflammatory cells. في حين B اللي هي the lower section, acute inflammation of the lung اللي هو acute bronchopneumonia. تلاحظون النيوتروفيل هي filling the space, alveolar space inside the alveoli. تشوفون هنا الالveoli are filled with inflammatory exudate and inflammatory cells, acute inflammatory cells, and the blood vessels are highly congested during acute inflammation. بالchronic inflammation تلاحظون الدومينانت feature هو الفايبروسيس والplasma cell infiltration, mononuclear cell, and heavily destructed alveoli. The cells and mediators of chronic inflammation. The role of macrophage is very important cell in chronic inflammation. The dominant cell in most chronic inflammatory reaction are the macrophage, which contribute to the reaction by secreting cytokines and growth factor that act on various cells by destroying foreign invaders and tissue, and by activating other cell اللي هي mainly the T lymphocyte. يعني الماكروفاج من تجي راح تعطينا cytokines which act as a mediator and growth factor. Growth factor اللي هي تسحب لنا other cells and help to many cells to proliferate in the same site. طبعا the main cell اللي هي activated by the macrophage اللي هي T lymphocyte. Macrophage are professional phagocytes that act as a filters for particulate matter, microbe, and syncytial cell. يعني شنو؟ يعني الماكروفاج هي خلية البلعمة المتخصصة اللي هي تشتغل مثل الفلتر، تصفي الميكروبز والبارتيكلز الموجودة at the same site of inflammation. They also function as effector cell that eliminate microbes in the cellular and humoral immune response. يعني هي تشتغل خلية مؤثرة انه تعرض الميكروبز in a cellular and humoral immune response. يعني antigen presenting cell تشتغل تاخذ الميكروبز وتعرضها على الليمفوسايت حتى الليمفوسايت تعطينا antibody to destroy that microorganism. So they are antigen presenting cell. But they serve many other roles in the inflammation and repair at the same time. Macrophage are tissue cell derived from hematopoietic طبعا stem cell in the bone marrow and from progenitor in the embryonic yolk sac and fetal liver during early development. Circulating cell of this lineage are known as monocyte. يعني المacrophage inside the tissue and in the blood they are called monocyte. The macrophages are normally diffusely scattered in most of the connective tissue, and they take different name according to the tissue they are present in. They are found in a specific location in organs such as in the liver نسميها Kupffer cell, in the spleen and lymph nodes نسميها sinus histiocytes, in the central nervous system نسميها microglial cell, and in the lung نسميها alveolar macrophage. Together these cells comprise the mononuclear phagocyte system. هذا الفيجر يوضح لنا الأوريجين of the macrophage. طبعا هي من البول مارو تروح هيموبويتيك stem cell يعني الخلية الأم, the cell of origin. هاي راح تعطينا blood monocyte. شوفوا تلاحظون الستم cell هي round nuclei, large nuclei, while in the blood they are monocyte. The nuclei change and become more specified cell. Specific cell هنا تحولت where the nucleus take a kidney shape. And later on it will be activated macrophage during inflammation in the skin, in the intestinal tract, so they will act as a specified cell. من الليفر طبعا هي originated in the yolk sac يعني during embryogenesis, progenitor in the yolk sac بالfetal liver type الفيتس, و resident tissue macrophage يعني تكون موجودة inside the tissue نسميها resident يعني ساكنة inside every tissue in the body اللي هي Kupffer cell in the liver, alveolar macrophage in the lung, and macroglial cell in the central nervous system, and so on. اوكي هنا تشوفون المونوسايت اللي هي موجودة, وتشوفون الactivated macrophage on the lower right side of the this slide. Activated macrophage تشوفون الفاكيولز الانزيمز اللي موجودة بيها طبعا filled large cell filled with vacuoles and proteolytic enzyme that can digest the microorganism. An inflammatory reaction, progenitors in the bone marrow gives rise to monocytes which enter the blood and migrate to many tissue and differentiate inside the tissues into macrophage. The half-life of the blood monocyte هو 1 day, but the lifespan of tissue macrophage is several months or years that accommodate with its function. So the macrophage become the dominant cell population in the inflammatory reactions within 48 hours of onset of the reaction. We have two major pathways of macrophage activation. These are classical and alternative pathway. Which of these two pathways is taken by a given macrophage? This depends on the nature of the signal that activate the macrophage. So in chronic inflammation, the macrophage accumulation persists, and this is mediated by the following. Number one, we have recruitment from the circulating monocyte تجي تقعد تتجمع بالtissue. Number two, local proliferation of the macrophage. So the second step is the proliferation of the macrophage after their immigration from the bloodstream. And three, immobilization of the macrophage within the site of inflammation. That's to say it become persistent at the same site to do its function. This is the classical and alternative macrophage activation pathway. You can see it carefully. The products of activated macrophage eliminate the injurious agent like the microbes and initiate the process of repair, but also it is responsible for much of the tissue injury in chronic inflammation. يعني هي at the same time it can eliminate the causative agent, but it can produce a damaging effect. Macrophage also responsible for much of tissue injury by chronic inflammation. The causes of these are: number one, toxic substance to the microbes and host cell at the same time. So the substance released from the macrophage are toxic to the causative agent and to the host cell, the viable cell, like toxic oxygen species, nitrogen monoxide, and the proteolytic enzymes اللي هي proteases. Also the chemoattractant to other inflammatory cells also can be responsible for tissue injury at the same time. Growth factor, the cause of fibroblast proliferation, collagen deposition, and angiogenesis. All these are responsible for the tissue injury in chronic inflammation. Macrophage secrete mediators for inflammation like cytokines. The most important here, tumor necrosis factor and interleukin 1 and the chemokines, and other اللي هي less common. and eicosanoid. Macrophage also display the antigen to the T lymphocyte. قبل شوية ذكرت لكم إنه الماكروفاج these are antigen presenting cell، يعني تاخذ الميكروبز وتسوي له presentation to the T lymphocyte to be activated and respond to signals from the T cell. Then there is a feedback mechanism, or there is a loop in between the macrophage and the T lymphocyte, in which the macrophage is presenting the antigen to the T lymphocyte to be activated, and the T lymphocyte after activation it will also give a signal for the macrophage, and it is a vicious circle of activation in between, or interaction in between the macrophage and the lymphocyte. So setting up a feedback loop that is essential for defense against many microbes by cell-mediated immune response. The role of the second cell, which is the lymphocyte. Microbes and other environmental antigen activate the T and B lymphocyte اللي هي amplify and propagate chronic inflammation. These cells are often present in chronic inflammation and are activated. The inflammation tends to be persistent and severe once these cells are present. Some of the strongest chronic inflammatory reactions, such as granulomatous inflammation اللي راح نجي نحكي بعد شوية, are dependent on lymphocyte response. Lymphocytes may be dominant population in chronic inflammation seen بالautoimmune diseases and other hypersensitivity disease. By virtue of their ability to secrete cytokines, CD4 positive T lymphocytes promote inflammation and influence the nature of the inflammatory reaction. So which type of the T lymphocyte? هي CD4 positive T lymphocyte اللي هي تعطينا the cytokines and secrete the cytokines which are responsible for the chronic inflammation. There are three subsets of CD4 positive T cell اللي هي تعطينا different cytokines and elicit different type of inflammation. T helper 1 تعطينا interferon gamma which activate the macrophage by a classical pathway. T helper 2 cells secrete interleukin 4, 5 and 13. This recruit and activate eosinophil, and this is responsible for alternative pathway of macrophage activation. Where T helper 17 اللي هي secrete interleukin 17 and other cytokines induce the secretion of chemokines اللي هي responsible for recruiting a neutrophil اللي هو preceding the chronic inflammation. لما يكون ال chronic it is following the acute. So the T cell is T helper 17 type of CD4 positive T cell which recruit the neutrophil during the acute phase of inflammation. This is the schematic presentation for the macrophage lymphocyte interaction in chronic inflammation. The activated T cell produce cytokine that recruit the macrophage. These cytokines are tumor necrosis factor, interleukin 17, and chemokines, and other that activate the macrophage اللي هي interferon gamma. The activated macrophage by itself stimulate another T cell by presenting the antigen through the cytokine like interleukin 12, and the cycle will continue. This is a gross appearance for cholecystitis, chronic cholecystitis with a cholelithiasis, يعني الstone within the gallbladder نسميها cholelithiasis. It is almost always associated with gallstone, chronic cholecystitis, and the microorganisms which are the causative agent are E. coli and enterocoli اللي هي موجودة بالGIT. Can be cultured from the bile in only about 1/3 of cases طبعا. The gallbladder may be contracted طبعا because of fibrosis of ممكن تكون of normal size or enlarged, especially during early stage of cholecystitis يعني بالacute phase. The submucosa and subserosa are often thickened from fibrosis. ده تشوفون under the stone there is a whitish layer of the lining epithelium of the gallbladder. This is the fibrous tissue accumulation in the lining of the gallbladder because of chronicity. Mural lymphocytes, mural يعني lymphocytes that are distributed throughout all the layer of the gallbladder are the only feature of inflammation during the chronic phase of the inflammation. We have many other cells. These are plasma cells from activated B lymphocyte and develop from the activated B lymphocyte and produce antibody directed against persistent antigen in the inflammatory site. We have the eosinophil, which are abundant in immune reaction mediated by immunoglobulin E and parasitic infection. We have the mast cell, which are widely distributed in connective tissue and participate in both acute and persistent inflammatory reaction. They express on their surface the receptor that bind the Fc portion of immunoglobulin E antibody, and present in a chronic inflammatory reaction may produce the cytokines that contribute to fibrosis. So they are very important cells. We have the neutrophil that, although characteristic of acute inflammation, but many forms of chronic inflammation continue to show large number of neutrophils, especially if they are coming after the acute phase of inflammation or acute inflammatory reaction, induced either by the persistent microbe or by mediator produced by the macrophage and T lymphocyte that can also at the same time recruit the neutrophil. In a chronic bacterial infection مثلا عندنا بالاوستيومايلايتس of the bone, a neutrophilic exudate can persist for many months. ممكن أن تبقى النيوتروفيل within the field. Neutrophil also important in the chronic damage induced in the lung by smoking and other irritant stimuli. This is a focus of inflammation containing numerous eosinophils. You can see here multiple cells which with a granulated cytoplasm stained pinkish in color. These are the eosinophils. الاسم مالتها من الاسم they are eosinophil يعني تصطبغ بالصبغة الحمراء. This type of cells are granulated, have a granulated cytoplasm. Granulomatous inflammation is a form of chronic inflammation characterized by collection of activated macrophage, often with T lymphocyte and sometimes associated with central necrosis. The activated macrophage may develop abundant cytoplasm and begin to resemble epithelial cell. لذلك نسميها epithelioid-like cell أو epithelioid cell. يعني once it is activated راح يصير عندها increased amount of cytoplasm, enlargement in the cell, وتبدي الخلية تشبه الخلايا الابيثيليال cell. Okay, some activated macrophage may fuse and forming multinucleated giant cell. And the granuloma formation is a cellular attempt to contain an offending agent that difficult to eradicate. يعني شنو؟ يعني الجرانيلوما هو عبارة عن body reaction أو tissue reaction to certain type of invaders or offending agent which is resistant to be eradicated. الجسم ما دا يقدر يوخره، فالجسم يبدي يحاول إنه يسوي certain focus of inflammation with certain type of cells which are very يعني resistant cell، خلايا مقاومة وخلايا تحوط offending agent، تحوطه بشكل تمنعه من السبرد. This reaction is called granuloma. It is in this attempt there is often strong activation of T lymphocyte that lead to macrophage activation later on. مثل ما حكينا قبل شوية there is a bidirectional interaction ما بين الماكروفاج والليمفوسايت which can cause injury to normal tissue. يعني هلقت severe الانتراكشن اللي هو may cause injury to the normal adjacent tissue بسبب الماتيريال which are released from the macrophage and lymphocyte. Tuberculosis أو السل الرئوي is the prototype يعني الexample المثالي of granulomatous disease. In this disease the granuloma referred to as a tubercle. الجرانيولوما بالtuberculosis أو بالسل الرئوي نسميها tubercle. Always necessary to identify the specific etiological agent by special stain for organism. For example, acid-fast stain for the tuberculous bacilli, by culturing method in tuberculosis and fungal disease, or by molecular technique اللي هو PCR نسميه polymerase chain reaction also in tuberculosis, and serological study اللي هي تطلع لنا الانتيبودي circulating in the plasma against this specific type of organism. إذن يا إما identify the organism either by special stain نصبغ الorganism itself, or by molecular technique اللي هو PCR اللي هو PCR can detect the genome of the bacilli وبهالحالة يسوي لها amplification وdiagnosis أو by serological study اللي هي detect the antibody circulating in the blood. طبعا الباسيلاي هي acid fast stain، يعني acid fast يعني مقاومة للأسيد. الwall of the TB bacilli contain certain material that cannot يعني ما ينقصر بالبروسيسنج، يقاوم الصبغة فيظهر باللون الأحمر. This is called acid fast bacilli. Morphology of granulomatous inflammation. In the usual hematoxylin and eosine stained tissue sample, the activated macrophage in the granuloma have a pink granular cytoplasm with distinct cell boundaries and are called epithelioid cell. إذا اللي راح نشوف الابيثيليويد cell inside the granuloma نشوفها على شكل large cell with a pinkish granular cytoplasm، هي عبارة عن activated macrophage. A cooler of lymphocytes surround the aggregates of epithelioid macrophage. بعد الماكروفاج طبعا احنا بدنا نحكي centrally و going peripherally، يعني نبدي من السنتر. الجرانيولوما هي عبارة عن focus of inflammation، هذا الفوكس بي layers، هاي اللايرز راح نبدي نسوي لها description من السنتر of the granuloma to the outside. بالسنتر عندنا epithelioid cell اللي هي activated large macrophage with a pink granular cytoplasm. Surrounding الماكروفاج أو الابيثيليويد cell هي الليمفوسايت surrounding the epithelioid macrophage. All the granuloma have a rim of fibroblast and connective tissue. طبعا كل ما الانفلاميشن او الكرونيك جرانيولوما كانت الديوريشن مالتها طويله او موجوده كرونيكلي، يعني with chronicity there will be proliferation of fibroblast اللي راح تسوي لنا تفرز لنا الفايبروس tissue، و these lymphocytes will be surrounded by fibrous tissue. Frequently multinucleated giant cell اللي هي 40 إلى 50 micrometer in diameter are found in the granuloma. هاي نسميها Langerhans giant cell. هي عبارة عن a large mass of cytoplasm and many nuclei. والgiant cell هي عبارة عن اتحاد or fusion multiple macrophage تسوي لنا single multinucleated giant cell. إذا multinucleated contain الgiant cell هي عبارة عن large cell containing multiple nuclei اللي هي جاية من اتحاد nuclei of multiple macrophages forming a single giant cell with multiple nuclei. Granuloma associated with certain infectious organism اللي هي Mycobacterium tuberculosis containing central zone of necrosis، وهذا النكروسيس نسميه caseous necrosis. caseous جاي من معناته جبني الشكل، يعني لونه وايتش إلى يلوش in color. مادة لما نجي نفحص الجرانيولوما من نتلمسها باليد لها ملمس النكروتيك سنتر اوف ذا جرانيولوما، لها ملمس يشبه ملمس الجبن، فنسميه caseating central zone of necrosis او caseating necrosis. إذا من هذا راح نستشف إنه الجرانيولوما consisting of multiple layer، هي عبارة عن دائرة. الليجن هو عبارة عن focus of inflammation consisting of multiple layers starting from the center اللي هو caseating necrosis اللي هو في حالة التيبي. فقط التيبي هو يحتوي على caseating necrosis ونسميها بهاي الحالة caseating granuloma. فالكازيشن هو عبارة عن central zone of necrotic debris taking a color yellowish to a whitish in color and it has a gritty sensation. gritty يعني محبب like the cheese، فنسميه caseating central zone of necrosis only present in TB. all other granuloma are non-caseating granuloma. اوكي following the caseation او necrotic center راح تجينا الابيثيليويد سيل اللي عبارة عن large activated macrophage تحولت بشكل تشبه الابيثيليال سيل فسميناها epithelioid cell. ممكن انه الابيثيليويد سيل او الماكروفاج fuse with each other forming multiple giant cell. These giant cells نسميها Langerhans giant cell containing multiple nuclei and in between there is lymphocytes, multiple lymphocytes surrounding the giant cell and the lymphocyte and the central zone of necrosis. In the periphery there is a multiple fibroblast with a fibrous tissue formation at the periphery. This structure is called granuloma. Okay, grossly this has a granular cheesy appearance. هذا في حالة الTB tuberculosis يكون cheesy appearance، وهذه الcaseating granuloma only in tuberculosis. All other type of granuloma are non-caseating granuloma. هاي المعلومة كلش مهمة. So cheesy appearance in tuberculosis طبعا and is therefore called caseous necrosis. caseous يعني من جبني الشكل. Microscopically the necrotic material appear as amorphous. Amorphous هاي central zone of cheesy material اللي هو قلنا necrosis يكون amorphous يعني ما له شكل، مجرد فد خلايا ميتة. Amorphous structureless ما له structure يعني ال boundaries of the cell are not clear. eosinophilic لونه أحمر من نجي نصبغه بالستين لأنه ما عندنا النيوكلياي، الخلايا كلها ميتة متحولة إلى دبريز فيطلع eosinophilic أحمر. Granular debris with a loss of cellular details. ما عندنا any cellular details. So this is important histological description or microscopical description of the caseating granuloma. The granuloma مثلا هسه اللي هي non caseating، احنا قلنا ال caseating granuloma نشوفها فقط في التوبركلوسيس. There are other type of granuloma اللي هي non caseating نشوفها in many disease مثل Crohn's disease اللي يصير بالجي اي تي، sarcoidosis هذا يعني disease of unknown etiology. Foreign body reaction tend not to have not have necrotic center and are said to be non-caseating. Okay, then these are non-caseating granuloma. إذا الجرانيلوما يقسموها إلى caseating granuloma containing cheesy central zone of necrosis inside the granuloma. This is seen only in tuberculosis. And non-caseating granuloma seen in many other situations like Crohn's disease, sarcoidosis, foreign body granuloma اللي راح نجي نحكي عليها بعد شوية. Healing of granuloma is accompanied by fibrosis that may be extensive طبعا لأنه عندنا قلنا بالperipheral zone of granuloma عندنا heavy infiltration of fibroblasts اللي راح تعطينا fibrous tissue formation واللي هو يحوط لنا الجرانيولوما. This is the diagram of typical TB granuloma. شوفون بالسنتر there is amorphous ما له شكل acellular structureless zone of caseation and surrounded by epithelioid cell. هاي تشوفوها هي عبارة عن modified macrophage activated macrophage and multinucleated giant cell. هي عبارة عن fusion of multiple macrophage تعطينا giant cell multinucleated giant cell. giant يعني كبيرة، multinucleated اللي هي multiple nuclei of multiple macrophage surrounded by lymphocyte الزرقاء. And in the peripheral layer there is a fibroblast accumulation تكون spindle cell with a central located in nuclei, and these fibroblasts will secrete at the later on in the periphery يعني اكو layer ثانية هنا ما مرسومة of fibrous tissue secreted by fibroblast. These are the diagram of typical tuberculous granuloma. طبعا هاي من نقول TB granuloma لأن عندنا caseation. إذا ما عندنا TB ماكو central zone of caseation، راح نشوف فقط lymphocyte وراح نشوف الepithelioid cell lymphocyte والfibroblast. This is the layers of any granuloma. This is also TB granuloma. تشوفونه هنا in the center. هذا low power view يعني احنا عندنا ال powers of microscope تبدي من الأربعة اللي هي كلش عالي يعني نشوف التكبير قليل مو هواية، بعدين followed by 10، بعدين عندنا 100 اللي نشوف السيلولار ليفل بيها، وعندنا الألف اللي هو نحط الأويل تكبير بواسطة الأويل immersion. فهنا هذا low power showing two distinct well defined rounded granuloma. شوفون بالسنتر طبعا هاي in the lung عندنا two layers أو two focuses of granuloma on the right side of the slide and in the center. الجرانيلوما اللي هي بالسنتر شوفون المالتي نيوكلييتد جاينت سيل كلش واضحة مثل الهورس شو نيوكلياي، تصفط النيوكلياي بالمالتي نيوكلييتد جاينت سيل Langerhans cell اللي سميناها على شكل حذوة الفرس. هاي nuclei of multiple macrophage fused together to form a giant cell. طبعا اللي جوا الأحمر اللي بالداخل اللي هو كازيوس ماتيريال. تشوفون هاي المحيطة بالماكروفيج هي الابيثيليويد سيل، واللي بالبريفري هي عبارة عن الليمفوسايت وفولود باي ذا fibroblast اللي هي spindle cell nuclei, and there is a multiple inflammatory cell infiltration in between. هذا التكبير شوية أكبر. This is a high power view showing a portion of Tb Granuloma. تلاحظون amorphous، هذا اللي بالسنتر هو الكازيشن، لا أكو حدود للخلايا، لا أكو نيوكلياي، لا أكو any cell موجودة، فهذا نسميه amorphous pinkish central causation. هذا هو الكازيشن. طبعا هذه high power field of the same granuloma of the previous section. Surrounded by a rim of epithelial cell. لاحظوا الابيثيليويد cell هي عبارة عن round cell، كلها هي عبارة عن modified macrophage round cell with يعني pinkish cytoplasm و round nuclei كلها مصفطة تشبه الابيثيليال cell. There are two types of granuloma which differ in their pathogenesis. عندنا الاميون جرانيلوما، يعني هي الجرانيلوما كستركتشر أخذنا. هسه cause of the granuloma. What is the cause of granuloma؟ يا إما عندنا immunely يعني derived granuloma اللي هي these are caused by insoluble, poorly degradable or particulate particle. يعني الماتيريال الانفكشيوس ماتيريال او الكوز اوف جرانيلوما هو الجسم ما دا يقدر يقضي عليه، ولا دا يقدر يكسره، ولا دا تقدر الماكروفيج لوحدها تجي تسوي له phagocytosis and eliminate it. So it is insoluble، ما يتكسر، poorly degradable صعب التكسير، or particulate particle يعني عبارة عن البارتيكل تسوي لنا فد ماتيريال اللي هي resist any defense mechanism. Typically microbes اللي هي resistant microorganism capable of inducing cell mediated immune response. من نقول cell mediated immune response اللي نقصد بها T lymphocyte والB lymphocyte, and mainly included in the granuloma هي lymphocyte هي CD4 positive T lymphocyte. In this response the macrophage engulf the inciting agent, process it يعني تقدمه. واحنا قبل شويه قلنا بالسلايدات السابقه انه الماكروفيج تشتغل as antigen presenting cell، يعني تبتلع المايكرو اورجانيزم هذا resistant microorganism وما تقدر تكسره، فتسوي له presentation to the lymphocyte, present some of it to appropriate T lymphocyte causing them to become activated. هذا هو الباثوجينيك part of the granuloma، انه الماكروفيج المفروض بالafter phagocytosis وبعد ان تبتلع المايكرو اورجانيزم تسوي له digestion و elimination, but it cannot digest the microorganism because it is resistant. So وشنو الفانكشن بهالحالة؟ انه it present the microorganism to the appropriate T lymphocyte and the T lymphocyte will be activated. The responding T cell will produce cytokines. تجي T lymphocyte تعطينا cytokines and اللي هي مثل interleukin 2 اللي هي activate other T cell and perpetuating the response، تقوي الريسبونس بعد الضعفة، and interferon gamma which is important in activating the macrophage. إذن هي تعطينا interleukin 2 يسوي لنا activation of additional T lymphocyte and يقوي الريسبونس، وتعطينا الانترفيرون جاما اللي هو بدوره activating the macrophage and transforming them، يحول الماكروفيج إلى epithelioid cell and multinucleated giant cell. The second type of granuloma is a foreign body granuloma. So the first type was immune mediated, the second هو foreign body. This is seen in response to relatively inert foreign body in the absence of the T cell mediated immune response. Inert شنو يعني؟ يعني foreign body اللي هو يبقى موجود in the body in our body and it can يعني provoke the reaction with the time slowly. For foreign body granuloma usually form around material مثل talc associated with intravenous drug abuse or sutures or other fibers that are large enough to preclude phagocytosis by macrophage but are not immunogenic. ما تكون immunogenic يعني تحفز الماكروفيج لكن not immunogenic، فالماكروفيج راح تشتغل لوحدها. epithelioid cell and giant cell are opposed to the surface of the foreign body. تلاحظون انه بهالحالة الابيثيليويد cell راح تتجمع around the foreign body, and the foreign material can usually be identified in the center of granuloma, particularly if viewed with polarized light in which it may appear refractile. تطلع مشعة إذا استخدمنا polarized microscope. تلاحظون هنا هذه هي الفورين بودي جاينت سيل in a suture granuloma. هاي كلها اللي متجمعة. طبعا هذا اللي هو الارو الأسود هو الفورين بودي، يظهر هنا مشع تحت المجهر، وتلاحظون multiple nuclei هي عبارة عن giant cell composed of fusion of multiple macrophage with a multiple nuclei. طبعا هنا نسميها foreign body giant cell or foreign body granuloma. This is a talc granuloma in the lung by using a polarized light. التالك هو الفورين material اللي هو راح يسوي لنا الجرانيلوما, and it appear bright white crystal in patient اللي هو أساسا intravenous drug user. طبعا الفورين ماتيريال produce granulomatous reaction اللي هو التالك الفورين ماتيريال. This is an important table show many examples of diseases with granulomatous inflammation. We say first of all we have to differentiate the caseating granuloma from non-caseating granuloma. In the beginning, tuberculosis caused a caseating granuloma, and the granuloma called tubercle, and it is caused by resistant microorganism which is Mycobacterium tuberculosis. This is the caseating type of granuloma. The other non-caseating granuloma اللي هي leprosy, the syphilis, cash-scratch disease, sarcoidosis, and the Crohn's disease, which is a part of inflammatory bowel disease. And for each type we have a causative agent and the tissue reaction. For the tuberculosis, caseating granuloma, or called the tubercle, focus of activated macrophage اللي هي مثل ما قلنا هي الابيثيليويد cell, and rimmed by يعني محاطة by fibroblast and lymphocytes. Occasional Langerhans giant cell is present. Central necrosis in the center اللي هو يحتوي على amorphous granular debris, والacid fast bacilli can be found. This is a histological section show multiple sarcoid granuloma. These granuloma composed only of epithelioid histiocytes, and there are some inside the granuloma giant cell. If you focus and see carefully, you can see multiple giant cell within the granuloma. The dark dots surrounding the granuloma, these are lymphocytes, heavy infiltration with a lymphocytes surrounding the granuloma, which is consist of a giant cell and epithelial cell, which are activated macrophage, and they are rimmed and surrounded by a heavy infiltration of the lymphocytes within the sarcoid lesion. And this is an important slide. Thank you very much.